welcome to this special conversation on pre-diabetes, a condition often overlooked in the broader discussion of diabetes awareness. Pre-diabetes is a serious health concern marked by higher than normal blood sugar levels, elevating the risk of developing type 2 diabetes, heart disease, and even stroke. As pre-diabetes cases surge globally, including in India, understanding its significance is very important, especially since, unlike diabetes, pre-diabetes typically lacks clear symptoms, making it a little challenging to detect. A recent ICMR study suggests that in India, a staggering 136 million people, more than the population of Maharashtra, or 15% plus of the entire country, are likely to be pre-diabetic. I'm Maloni Bhatt, and today we're joined with a panel of distinguished diabetologists who will help us understand the symptoms and manage the care of prediabetes. With that, I'm very happy to welcome Dr. V. Mohan. He's the chairman and chief diabetologist of Dr. Mohan's Diabetes Specialty Center in Chennai. Dr. Mohan, welcome to Economic Times.
Thank you, Melody.
We have with us Dr. Anoop Misra. He is the chairman, Fortis CDOC Center of Excellence for Diabetes, Metabolic Diseases, and Endocrinology at New Delhi. Dr. Misra, what a pleasure.
Thank you.
And we have with us Dr. A. Ramchandran. He's the chairman and managing director, Dr. A. Ramchandran's Diabetes Hospital, and president of India Diabetes Research Foundation. Dr. Ramchandran, it's our honor to have you here with us.
Thank you.
Dr. Mohan, I'd like to begin with you first. Between 2019 and 2021, 31 million people in India became diabetic. And there's been talk about the rise of diabetes in India, the health risk that it poses. However, pre-diabetes, as I spoke earlier, is not spoken about as much. How serious of a condition is pre-diabetes, and why would you say it is not spoken about in the same way as diabetes is?
When we say that 31 million people became diabetic in 2 years' time, this refers to two independent assessments which were made. So in 2019, we had a number of 72 million, and then suddenly when that became 100 million, it looked as if 31 million people developed diabetes in that 2-year period. That is not the case. The original number was based on the ICMR INDAP study, the states which were completed. And 7 of those states were in the Northeast region, which had very low prevalence rates of diabetes. Subsequently, when the full India report was published, the high prevalence states like Kerala, Goa, Puducherry, Haryana, Punjab, many of those got added. And therefore, the prevalence rate went up. So it's not that 31 million people suddenly developed diabetes in 2 years' time. Having said that, there's also a period when COVID hit us. And there is a lot of COVID-induced diabetes as well. So it has gone up, but we cannot say exactly 31 million went up. Now, going back to pre-diabetes, I think you said it in your introduction, that the number of people with pre-diabetes in India is 136 million. We just said that the number of people with diabetes is 101 million. So if you compare diabetes and pre-diabetes, it means that there are more people with pre-diabetes in India than there are people with diabetes. Now, why is that significant? It is significant because diabetes develops mostly in people who have already gone through that phase of pre-diabetes. So if the Dr. Ramchandran studies and my studies and Dr. Misra studies have shown that when the epidemic matures, what happens is that the diabetes numbers will go up, but then the pre-diabetes begins to go down. So then we know, okay, the epidemic is kind of maturing and flattening off, and you're not going to see huge increases. When you have more people with pre-diabetes and diabetes, it means that by no stretch of imagination is the epidemic over, but we're going to see more and more people transition from the pre-diabetes into diabetes. So it will not be surprising that unless something is done, and that's what today's discussion is all about, that the numbers with diabetes will go to 120 million, 150 million, even 200 million they can reach if all these people start getting transition into diabetes. Now, why is it that we're not focusing on pre-diabetes? You gave the answer yourself. It's predominantly an asymptomatic condition, which means it's not something, if you have a toothache, you won't wait for 1 year we'll go in 10 minutes, you'll go to the dentist. If you have a headache, also the same thing. But you have absolutely no symptoms, and your blood tests also don't even tell you that you have diabetes. Who will go rushing to a doctor? And yet, Pre-diabetes is as dangerous as diabetes because heart attacks, strokes, and all other complications, of course, development of diabetes, all that are there in people with pre-diabetes. So it is very necessary to screen for pre-diabetes and to treat it and reverse it if possible.
All right. I think you've given us a comprehensive understanding of this, Dr. Mohan. But building on that, Dr. Misra, in the Indian context, can you speak to the prevalence of pre-diabetes and what are the cultural and or lifestyle factors that contribute to this prevalence?
So there are three factors that need to be considered. Number one, pre-diabetes is a moving target. So what was there in 2017 has increased in 2023. So say, for example, let me give you a couple of figures: 6 to 15% in 2017, and now 15% in most of the places. And one recent NCD survey shows 1 in 4 people, that means 25% of the people have pre-diabetes, mostly impaired fasting glucose, means fasting glucose is slightly on the higher side. So it's a moving target, it is increasing. And the second thing which needs to be considered is that there used to be a urban-rural divide. That urban places, there was more pre-diabetes, diabetes, and rural areas. Now, pre-diabetes is actually surpassing the urban prevalence. And that is something which is particularly concerning because these are the people who probably don't know much about diet and exercise and what are the ill effects of diabetes or pre-diabetes. So that is number two. Number three, Indians as such, our pre-diabetes progresses to diabetes at twice the faster rate than white people. And if we do the same amount of exercise and diet, reversal to normal, which should be our aim, is twice more difficult. So these are the three characteristics which must be known by everybody. So our pre-diabetes is more difficult and more converts to diabetes, faster conversion. Now the factors remain the same as for diabetes. So we have physical inactivity, which is more than any other race in the world. And we have a lot of dietary indiscretion. Our urbanization and mechanization has destroyed the metabolism in such a manner that blood sugar starts increasing at a faster rate at a younger age. So these are the factors which have increased. So today, sitting in Delhi, I see a lot of pollution, and there have been a recent study by Mohan's group that pollution also increases. So number of factors are being added because of urbanization, population density, and mechanization, and so on. So these are the factors which are responsible.
Yeah, it's a very sobering thought, when you say that, we develop diabetes faster than perhaps any, people of the West. Dr. Ramchandran, both Dr. Mohan and Dr. Misra, I think briefly mentioned, but can you talk to us about the symptoms of prediabetes, because often they can be subtle. So can you shed light on the specific challenges that Indians may face in recognizing prediabetes symptoms?
Okay, as you already mentioned earlier, pre-diabetes is a metabolic disorder and is absolutely asymptomatic. It is very uncommon to have symptoms. But however, there is one symptom which can probably give you some clinical clue that you have pre-diabetes, and that is there is a condition called reactive hypoglycemia. When we are very hungry, you may be very uncomfortable, irritated, and even angry. And at that time, your sugar may go too low. And this low blood sugar occurring 3 to 4 hours after a heavy meal is one of the symptoms of pre-diabetes. And this happens in very young individuals. So especially people who are working in the IT, if they feel very, very irritated and also tensed up and they're hungry, they have to look for pre-diabetes. Now, who should look for pre-diabetes? Those who have a family history of diabetes and those who are overweight, especially if you have a tummy and if your waist is bigger, if the measurement of your waist is higher, that is called central adiposity. So those who have a family. And as Anoop was telling, that this pre-diabetes means it is not just a state where diabetes, you are at a high risk of diabetes. There is a very high chance it is also associated with high blood pressure, hypertension, high cholesterol, and obesity, which are a cluster of factors which make the individual give high risk of cardiovascular disease. As you already mentioned, it is not only diabetes, pre-diabetes also give you higher risk of cardiovascular disease other than the risk of diabetes itself. But the good news is that with lifestyle modification, you can reverse pre-diabetes. Once you develop diabetes, reversal is a rarity. It's very difficult. But preventing diabetes at a stage of pre-diabetic stage is possible today. And therefore, it gives a window of opportunity to prevent diabetes. And therefore, it is important that the public should be aware of a condition called pre-diabetes, and they must know who should be tested for pre-diabetes.
All right. And we'll touch upon these issues of lifestyle modification and, the sort of screenings that are available for people, just to make sure that they don't transition from pre-diabetes to diabetes. But Dr. Mohan, if I could come to you, what are the key differences, say, between pre-diabetes and diabetes in terms of symptoms? Symptoms, yes, everyone has said that it's high, it's difficult to detect pre-diabetes, but, how would you say it would affect, say, a diabetic person and a pre-diabetic person in the way that it would affect their day-to-day life, or the way that they would manage their life?
So the reason why in the first place this pre-diabetes entity was created and diabetes was kept separate was because people with diabetes, when you cross over to the stage of diabetes, you are prone to develop not only the large blood vessel disease, which is the heart, the brain, and so on, which people with pre-diabetes are also prone to develop, but they can develop a fresh set of complications which affect the small blood vessels in the body. And this is in the eye, where you develop diabetic eye disease leading to blindness, or it can lead to kidney damage. And in fact, diabetes is the commonest cause of kidney damage or kidney failure, not only in India, but in the whole world. And thirdly, it can also affect the nerves. It can also affect, of course, other things like infections and so on. But these are the three main complications: the eye, the kidney, and the nerves, which people with pre-diabetes rarely they develop it. Of course, academically, if you speak, a very small minority of pre-diabetic can also develop eye, kidney, and nerve, but it's very, very rare.
All right. Okay. Dr. Misra, considering India's diverse landscape, what would you say are the recommended screening practices for pre-diabetes, and how do you see healthcare providers in different settings being able to collaborate to improve early detection?
Good point. There are four parts of my answer. Number one, whom do we screen? Because that's a universal screening recommendation, and whether it's India or abroad, any country. So some of it has been said by Dr. Ramchandran. So one person who's obese, the BMI is high, body mass index is a measure of obesity, which is high, more than 23. The waist circumference, you can measure with the tape, is more than 90 centimeter in males and more than 80 centimeter in females. So anybody can measure that, or you can measure by belt size also. Number three, a person who has metabolic syndrome, there are multiple components of that. So a person has hypertension, a person has high cholesterol, any of these need screening for pre-diabetes, because that's a part, then it becomes something called as metabolic syndrome. Then a female who had a polycystic ovarian disease in the maybe a couple of years back or something like that. A female who was given large baby, birth to the large baby, and also had some abnormal glucose metabolism during pregnancy. And the most important is family history of diabetes. If these are the factors, then a screening is must. And I, Dr. Ramchandran, and the others have written a paper that screening should start at 25 years, regardless of presence of these things, whether they are present or not. 25 years. Why? Because we are seeing pre-diabetes at an early stage. And those who have these factors, perhaps earlier than 25 years, that is the situation in India versus 35 years in the United States. So that's the first part of my answer. Number two, pre-diabetes consists of two portions. One is when the fasting blood glucose is slightly high, and second is after ingesting the 75-gram glucose, 2 hours blood glucose is high. Now, these are two different components. Among them, the post-glucose 2 hours component, if it's high, is called impaired glucose tolerance, is more deleterious to the heart, which Dr. Mohan was talking about. Right. That means it is directly problematic to the heart, causes myocardial infarction, atrial fibrillation, irregularity of the heart, and congestive heart failure, etc. So 2 hours is important to screen. So you don't go only by fasting blood sugar. 2 hours is important to screen. And when both are high, you need to probably reach screen at a shorter interval versus one is high, then 1 year interval you screen, except in those conditions where the predisposition there, for example, family history. And last answer is how to improve the practices of healthcare workers. Well, all of us are already doing that in making guidelines, giving lectures, but perhaps that's not enough. And people like you and your channel will do better to disseminate this information to the general public. But more such things are required. This is a major problem, because most of the healthcare workers will be blank on pre-diabetes and its associations. So that's where we have to do a lot more.
Doctor, I have just one question, to the point that you made earlier, that if you, test your fasting blood sugar, and then, you don't come within the range for pre-diabetes or diabetes, should you then still go in for the 2-hour, after consumption of 75 grams and then, sort of 2-hour test?
Very good question. Because the metabolism of Indians is such that 2 hours glucose is often higher than the fasting blood glucose. And hence my practice, and I'm sure my colleagues' practice is the same, that we do both the sugars and first go when we are diagnosing pre-diabetes or diabetes, we do a proper oral glucose tolerance test. That means fasting blood glucose after 8 to 10 hours of fast, and then give in 1 glass of water, around 200 ml of water, 75-gram glucose, tell them to drink over 5 minutes. The moment they start drinking, 2 hours later, we take one more sample. This is the complete procedure. The best test, the gold standard test till now, nobody has surpassed this till now as far as diagnosis of pre-diabetes and diabetes goes.
Dr. Ramchandran, you mentioned lifestyle modifications earlier when responding to us on a different question. But, considering the wide range of diets and activity levels across different regions in India, what would you say are the evidence-based lifestyle modifications that are particularly effective in managing pre-diabetes so that it does not transition into diabetes in the Indian context?
Yeah. So we have done studies called primary prevention of diabetes among people with pre-diabetes using lifestyle modification. And when you say lifestyle modification, it is not a very complicated affair. People have to know that only the principles of what you're going to do. For example, if you take concentrated carbohydrate, one of the first things to do in lifestyle modification is that you avoid sugar and sweets and fats as much as possible. Mm-hmm. The second point is the total amount of food has to be restricted and can be also distributed for the whole day so that you don't load your stomach with a lot of carbohydrate. So therefore, diet is a very simple affair. Anywhere in India, people are used to a lot of sweets and sugars and fats. So avoid that as much as possible. The second thing is increasing your physical activity level. Unfortunately, we have found that the Indian population, the physical activity level is much lower, especially in the urban population. We have done studies even in children. Our school children, adolescents, the physical activity level is much lower compared to the British or the European or the American children for several reasons. That is different to discuss now. So, therefore, increasing physical activity is a part of lifestyle modification. And again, that is not complicated. Simple walking for 30 minutes a day will do the job.
Dr. Mohan, to you, this is linked to the question, that we had for Dr. Ramchandran. Doctors will always advise patients, do this is good for you, follow this will work. But, individuals may not be able to implement all of it, maybe due to so many factors. So how would you say healthcare professionals can personalize support to patients in implementing and sustaining this healthy lifestyle changes, such as the diet modification or increased physical activity that Dr. Ramachandran spoke of, while we consider, say, cultural variations, maybe socioeconomic factors, regional differences, so that, they are able to successfully implement the changes?
First thing is that doctors themselves can be role models. So when they see doctors who are fit, who are role models, when we talk to people with pre-diabetes or diabetes, they listen to us more. Suppose when he was coming in, I was smelling of smoke and I was, obese and I'm myself very unfit. He's very unlikely to listen to me. So that's the first thing. You can be a role model, a leader in society, and you can do the healthy things which you are telling your people to do. Second thing is simplify things. For example, for diet, if you keep saying so much carbohydrate, so much protein, so much fat, so much fiber, even doctors may not understand that, even nutritionists may not understand it. So if we simplify it, let's say in the context of diet, if you just say, follow the plate concept, the thali concept. Now, the normal way in which we are used to eating is, let's say it's a buffet, and you've gone there and you picked your plate. The first thing that you'll do is you look for some rice or some chapati or something else. The carbs will go in first. So what we teach people is, look at the plate and half of that plate you reserve for non-starchy, green, leafy vegetables. That is the healthiest you can get. Very low calorie, and it has a lot of nutrients. It has vitamins. It has iron, B12. Everything that you need for health is there in that. And also it's very filling and very low calorie. Now, the second half of the plate, quarter of it you keep for protein. If you're a non-vegetarian, you can have a piece of chicken or fish or white of the egg, something like that, with some veggies at the side, or that should be enough for you to get your protein. For vegetarians, we need to think of what to put in there, and therefore you get the grams and pulses. So Bengal gram, green gram, black gram, rajma, all these kinds of mushroom. All these are very high in protein, and then you can keep that. Protein also is very filling, and it reduces your appetite. Now you got the quarter of the plate. In that quarter, you can have one chapati or two chapatis or a little bit of rice. That's all there'll be space in that plate to eat. So by this, you reversed the excess carbohydrate and now brought in a lot of protein and fiber and a lot of vitamins, and telling everyone, well, you have to go for a walk every day, 1 hour. And people will say, I don't have a place to walk. It's not safe. There's too much of smog and smoke, and there are trucks there are no footpaths. They'll give you 100 excuses for that. Instead of that, you say, what is it you'd like to do? Would you like to play tennis? Would you like to go for a swim? Would you like to jog? Would you like to go cycling? Would you like to go running or walking? Or would you like to do dancing? Now, dance is something which appeals to everyone at any age, men, women, young, old, anyone. Now, we can set it now. My daughter had introduced a concept called as Tanda. This is high-intensity dance, which can be done in just 12 minutes. In 12 minutes, you get a whole hour's worth of physical activity. So it's like walking for 1 hour, and just by doing 12 minutes of this high intensity, and they can enjoy it. They can put on the music that they like, and they can dance, and then get all the physical activity. So I'm just giving one example of that. So if you make it little more friendly, then people will say, oh, that's something I can do. Give something that they can enjoy.
I just want to add a couple of things what Mohan said, and because we didn't talk about the components of diet. The important thing is, of course, fruits are very good diet. The other important thing is that many people have a misconception that dry fruits are good. You see, you have nuts and dry fruits, which is usually given for 𝗗𝗶𝗀𝗶𝗺𝗃, etc. The nuts are good and they have antioxidants, the proteins. But the dry fruits are risky because that increases the sugar very high. So you have to avoid dry fruits. On the other hand, natural fruits are very good. One more point, and that is when we did the trials with lifestyle modification, most of the trials we do for 2 years or 3 years, and then you terminate the trial. One of the important things we have noted was that during the trial, the intervention arm, which actually had the dieting and exercise uh, advice, and they did it, they continue to do that for the next 5 years without intervention, which means there was what's called a post-trial effect of lifestyle
Right.
modification for many years, preventing diabetes.
We have been looking at school children who are 12 years old, 15 years old. Many years ago, 10 years ago, pre-diabetes was extremely uncommon and type 2 diabetes virtually unknown in that population. Today, if you're obese and you have a family history of diabetes, between 12 to 15% of teenagers have pre-diabetes. Of course, diabetes is still not that high. Occasionally, you will get diabetes also at that age group. So pre-diabetes starts much earlier today, especially if you have a family history and you have obesity, because junk foods are being eaten by everybody, especially in urban areas, and obesity is increasing. When I was in school, I used to have one obese child in the whole school. Today, 30%, 40% of the class is obese. Very few thin people today. It's complete transition. And if you have a family history also, and you have obesity, and then you have PCOS, which was mentioned earlier, then the prevalence of prediabetes starts much, much earlier, not at 20, 25, even during childhood.
All right.
So just to add to that, what Mohan has rightly said, in 2004, our group and Ramchandran group, 2003, 2004, that was 2 decades ago, we showed in very young people that diabetes is already occurring, pre-diabetes is already there. So there's nothing new, but only it has increased over a period of time. As Mohan has rightly said, recently there is a paper between 10 to 19 years, there is a 12% prevalence of pre-diabetes. And it's wholly only due to obesity and abdominal obesity. So this is one concern as far as young people is concerned. But there is another concern, and that's not in young people. That's in the women who are 30, 40, and 50 years of age, who have become, recently had a delivery, gained 6 kg of weight, never lost it. Another pregnancy, gained another 5 kg of weight, never lost it, become obese by 35 to 40 years of age, become pre-diabetes, and their physical activity is nil, and their food, because during pregnancy, etc., they have been taking all sorts of food. So that's where another peak is there. And then post-menopausal. Menopause is a danger period where everything goes haywire. And that's where sugar starts increasing rapidly. So these are 3 peaks which are coming, we have come to know through various studies. And these problems must be countered at these ages.
All right. No, these are important points. And, we hope that people who are watching take note of it, and if they are, or their family members fall into any of these groupings, then they take adequate action. Dr. Ramchandran, this last question is for you. In the context of India's very diverse healthcare infrastructure, how do you see telemedicine and technology being leveraged to provide support and monitoring for individuals to manage pre-diabetes, especially in remote or less urbanized settings?
Yeah, I think the first thing is to reach out to people and see whether we can make people aware and increase the awareness regarding diabetes as well as a condition called pre-diabetes. Actually, we did a study along with the Ministry of Health and WHO in order to reach people through mobile phones and asking them few questions like family history of diabetes, their present body weight and height, and their age, as well as about the stress factors. From that, we actually identified the risk of pre-diabetes and told them to go for the testing. And mind you, about 50% of them did the test within about 1 year's time, and we had a very good yield of pre-diabetes. So we can use mobile technology in order to reach out to people in a very, very cost-effective manner in order to increase awareness regarding diabetes as well as pre-diabetes, and also to encourage people to go for screening for pre-diabetes. The second point is that we also have done research now to see whether we can change and modify the behavior of people using mobile phones in order to reduce the risk of developing diabetes. And it has been really a successful story that I got to tell you, that we sent a simple SMS to people to start on a diet program, as well as to start encouraging exercise in those people for a 2 year period. And to our surprise, we found in that study there was a 36% relative risk reduction of diabetes in those people who received the mobile phone SMS from us. So therefore, I think today there is an explosion of social media, internet in any very part, and we can use this to actually not only to give information, but also to change the behavior of people, to modify their lifestyle, and to see whether there is a good chance of making them healthier and preventing chronic diseases such as diabetes, hypertension. But mind you, when you talk about pre-diabetes, it is not just pre-diabetes. Again, I want to tell you that it is a clustering of risk factors which has got association with hypertension, high cholesterol, and obesity. Therefore, they have a risk of not only getting diabetes, I think we have to just say that 3 or 4 times, not only getting diabetes, but they also have a high risk of getting cardiovascular diseases. We see young people with no history of diabetes, no history of hypertension, suddenly going to a stroke or a heart attack, which is very common. You would have seen in the news that very many young people are getting heart attacks in India. And one of the reasons is undiagnosed pre-diabetes, undiagnosed hypertension in those people who have especially family history of diabetes, hypertension, etc. So mobile technology, information technology, social media can be used in a very cost-effective manner, and we have shown that it is effective to increase awareness regarding health as well as to improve behavior of people to make their life much healthier.
Right. It's a very sobering thought, Dr. Ramchandran. Just how pre-diabetes could affect so many aspects of our health. Thank you very much for your insights and for this information, and of course for this knowledge base, I think which will be very beneficial to all the people watching. Dr. Mohan, Dr. Anoop Misra, and Dr. A. Ramchandran, thank you very much for being a part of this, and thank you very much for your thoughts.
Thank you. Thank you.
Thank you.
Thank you.